Alzheimer's disease and dementia have been rising sharply in recent years, with the World Health Organization estimating that over 55 million people worldwide are living with dementia today. This number is expected to double every 20 years, reaching 78 million in 2030 and 139 million in 2050, highlighting an urgent need for awareness and prevention. But did you know that some common medications might be contributing to this alarming trend? That's right, certain widely used drugs have been linked to a higher risk of developing dementia. In this video, we'll explore 8 types of medications that research has identified as potential contributors to cognitive decline. We'll break down how each of these medications could impact brain health and what you can do to protect yourself or your loved ones. Remember, it's essential to consult with your healthcare provider before making any changes to your medication. They can help you weigh the benefits against the risks and guide you in making the best decisions for your health. So, stick around as we unravel the connections between these medications and dementia, and learn how to make informed choices about your treatment options. Let's get started. Number 1. Anticholinergics. First on our list are anticholinergics, a class of drugs used to treat a range of conditions including allergies, colds, insomnia, and overactive bladder. Some familiar anticholinergics include diphenhydramine, Benadryl, oxybutynin, ditropan, and amitriptyline. While effective for these purposes, there is growing evidence linking long-term use of anticholinergics to an increased risk of dementia, especially in older adults. A notable study published in JAMA Internal Medicine in 2015 investigated the relationship between anticholinergic use and dementia risk. The research found that older adults who used anticholinergic medications for extended periods had a 54% higher risk of developing dementia compared to those who did not use these drugs. This increased risk was found to be dose-dependent, meaning that the longer and more frequently the medications were used, the greater the risk of cognitive decline. The primary concern with anticholinergics is their impact on acetylcholine, a neurotransmitter essential for cognitive functions such as memory and learning. By blocking acetylcholine, these drugs can disrupt communication between neurons, leading to cognitive impairment. 2. Benzodiazepines. Next on our list are benzodiazepines, a class of medications commonly prescribed for anxiety, insomnia, and other conditions requiring sedative effects. Well-known benzodiazepines include diazepam, Valium, alprazolam, Xanax, and lorazepam, Ativan. Although these drugs can be highly effective for short-term use, there is growing concern about their impact on cognitive health, particularly with long-term use. A 2014 study published in the BMJ explored the association between benzodiazepine use and dementia risk in older adults. The study analyzed data from over 8,000 participants and found a significant correlation between long-term benzodiazepine use and an increased risk of developing dementia. Specifically, individuals who used these medications for more than 3 months had up to a 51% higher risk of developing dementia compared to non-users. The risk was dose-dependent, meaning the longer and more frequently benzodiazepines were used, the greater the risk. Researchers believe that benzodiazepines may contribute to cognitive decline through their depressant effects on the central nervous system, which can impair memory and cognitive function. Additionally, these medications can lead to sedation and reduced cognitive activity, which may further exacerbate cognitive decline. 3. Antidepressants. Third on our list are certain antidepressants, specifically tricyclic antidepressants, TCAs, which have been used for decades to treat depression, anxiety, and other mood disorders. Common TCAs include amitriptyline, nortriptyline, and clomipramine. While these medications can be effective for managing symptoms, recent research has raised concerns about their impact on cognitive health, particularly with long-term use. A 2018 study published in the Journal of Clinical Psychiatry examined the link between TCAs and dementia risk. The research found that long-term use of TCAs was associated with a 30% increased risk of developing dementia compared to non-users. The study suggested that TCAs might contribute to cognitive decline through their anticholinergic effects, which interfere with acetylcholine, a neurotransmitter critical for memory and learning. In addition to affecting neurotransmitter systems, TCAs can cause sedation and reduced mental alertness, which may further impair cognitive function. The risk appears to be higher with prolonged use and higher doses, especially in older adults who may already be at greater risk for cognitive decline. 4. Antipsychotics. Next, let's talk about antipsychotics, medications primarily used to treat severe mental health conditions like schizophrenia, bipolar disorder, and severe depression. Commonly prescribed antipsychotics include risperidone, olanzapine, and quetiapine. While these medications can be life-changing for those who need them, there's growing concern about their effects on brain health, especially in older adults. A 2019 study published in Alzheimer's Research and Therapy found that older adults who used antipsychotics had a significantly higher risk of developing dementia, especially when these medications were used long-term. The study suggested that antipsychotic drugs could increase dementia risk by affecting neurotransmitter systems in the brain, leading to cognitive impairment and accelerated brain aging. Additionally, antipsychotics can cause sedation and reduced mobility, which indirectly contribute to cognitive decline by limiting physical activity and social engagement, both crucial for brain health. If you or a loved one are on antipsychotics, especially for behavioral symptoms of dementia, it's essential to have regular discussions with your healthcare provider to explore safer alternatives and monitor any cognitive changes. 5. Statins. Let's explore statins, a class of drugs widely used to lower cholesterol levels and reduce the risk of heart disease and stroke. Common statins include simvastatin, Zocor, atorvastatin, Lipitor, and rosuvastatin, Crestor. While statins are effective in preventing cardiovascular events, recent research has raised concerns about their potential impact on cognitive health. A 2020 study published in Frontiers in Aging Neuroscience investigated the link between statin use and dementia risk. The study found that older adults taking lipophilic statins, which are fat-soluble and can cross the blood-brain barrier, might be at an increased risk of developing dementia. The research suggested that these statins could affect brain health by interfering with cholesterol metabolism in the brain, which is crucial for maintaining neuronal cell membranes and overall cognitive function. Moreover, the study indicated that while hydrophilic statins, which are water-soluble and less likely to cross the blood-brain barrier, did not show the same increased risk, the concerns about lipophilic statins remain significant. It's essential to remember that the benefits of statins in managing heart disease often outweigh the risks for most patients. However, if you're concerned about the impact of statins on cognitive health, discussing alternative treatments or adjusting your medication with your healthcare provider might be a prudent approach. 6. Opioids. Now, let's discuss opioids, a class of powerful medications prescribed for managing moderate to severe pain, often following surgery or injury. Common opioids include oxycodone, OxyContin, hydrocodone, Vicodin, and morphine. While these drugs are highly effective for pain relief, their long-term use has been associated with significant risks, including cognitive decline and an increased risk of dementia. A 2021 study published in the Journal of the American Geriatrics Society investigated the impact of long-term opioid use on cognitive health in older adults. The study found that individuals who used opioids chronically had a markedly higher risk of developing dementia compared to those who did not use these medications. The increased risk is believed to be due to several factors. Opioids can impair brain function by disrupting neurotransmitter systems and reducing neuroplasticity, which is the brain's ability to adapt and form new neural connections. Additionally, opioids can cause sedation and decrease overall physical activity, which further contributes to cognitive decline by reducing mental and physical stimulation. 7. Proton pump inhibitors, PPIs. Let's dive into proton pump inhibitors, or PPIs, which are commonly prescribed to manage conditions like acid reflux, heartburn, and peptic ulcers. Well-known PPIs include omeprazole, Prilosec, esomeprazole, Nexium, and pantoprazole, Protonix. While these medications are effective in reducing stomach acid and alleviating symptoms, recent research has raised concerns about their potential impact on brain health. A significant study published in JAMA Neurology in 2016 explored the association between long-term PPI use and dementia risk. The study found that older adults who regularly used PPIs had a 44% increased risk of developing dementia compared to those who did not use these drugs. Researchers suggest that PPIs might influence dementia risk through several mechanisms. One theory is that PPIs may interfere with the metabolism of amyloid beta and tau proteins, which are crucial in Alzheimer's disease pathology. Additionally, PPIs can reduce the absorption of essential nutrients, such as vitamin B12 and magnesium, deficiencies of which have been linked to cognitive decline. 8. Antiepileptics. Finally, let's look at antiepileptic drugs, which are primarily prescribed to manage seizures in conditions such as epilepsy. Some common antiepileptics include gabapentin, Neurontin, carbamazepine, Tegretol, and valproic acid, Depakote. While these medications are essential for controlling seizures, recent research has raised concerns about their potential long-term effects on cognitive health. A 2018 study published in the Journal of Alzheimer's Disease examined the relationship between long-term antiepileptic drug use and the risk of developing dementia. The study found that individuals who used certain antiepileptics for extended periods had a significantly higher risk of dementia compared to those who did not use these medications. Researchers believe that these drugs may contribute to cognitive decline through various mechanisms, including their sedative effects, which can impair cognitive function and memory over time. Additionally, antiepileptic drugs may alter brain chemistry and reduce overall brain activity, potentially impacting cognitive health. The study highlighted that while these medications are crucial for seizure control, it's important to balance their use with monitoring for any cognitive changes. And there you have it, 8 medications that could increase the risk of severe dementia. If you're taking any of these, don't panic. But do talk to your doctor about your concerns. And remember, it's always essential to weigh the benefits and risks of any medication. If you found this video helpful, hit the like button, share it with someone who needs to hear this, and don't forget to subscribe for more health insights. Thanks for watching, and stay healthy.